Hi, I'm Dr. Ed Keystone. I'm a rheumatologist and professor of medicine at the University of Toronto. Today I'm going to talk with you about the safety aspects of a specific kind of therapy called biologics, which are commonly used for the treatment of rheumatoid arthritis. You can download a helpful resource tool from rheuminfo.com to follow along with this video. There are a number of biologics available to treat rheumatoid arthritis. This talk will focus on the class of biologics called tumor necrosis factor inhibitors, or TNF inhibitors. Before we start, I want to mention that TNF inhibitors have absolutely revolutionized the treatment of rheumatoid arthritis. Arguably, they're one of the most effective therapies available today. I'm going to focus this talk on the two most common safety-related issues with TNF inhibitors, namely serious infection and cancer. Let's start with serious infection. What's a serious infection? We as physicians define a serious infection as an infection where you either end up on IV antibiotics or you end up in hospital. So it's pretty important that we take these things seriously, and hence the term serious infection. Let's say you've got rheumatoid arthritis and you're on a disease-modifying drug, or DMARD, like methotrexate. What's your risk of a serious infection? I think the best data would tell us that if we follow 100 people just like you for a year, about 4 in 100 would end up with a serious infection. Let's take that same group of 100 people and add in a biologic and follow them for a year. Initially, the risk would increase 1.5 to 2 times, meaning about 6 to 7 in 100 would end up with a serious infection. However, for those who do well through the first 6 to 12 months with no infection, the ongoing risk does not seem to be increased over time. So you can see, although the risk of infection does increase, it's still pretty low. There are a couple important points to remember though. Number one, it's important to think of other things that increase your risk of serious infection, such as if you've had a serious infection in the past, if you're taking prednisone, which is a steroid used to manage your arthritis, if you're over the age of 70, if you have diabetes or emphysema, or any other illness that increases your risk for infection, and finally, and importantly, if your rheumatoid arthritis is particularly severe. Number two, the risk of serious infection seems to be higher in the first 6 to 12 months of any treatment in rheumatoid arthritis, including DMARDs, prednisone, or biologics. Many people who develop a serious infection will do so within this time frame, and heightened awareness during this period is truly important. Now on to cancer. The question, you've got rheumatoid arthritis. Are you at an increased risk of cancer? The available scientific and real-world data would say yes, but the risk is only elevated for certain types of cancer. It is fairly safe to say that rheumatoid arthritis increases your risk of lymphoma, which is a type of blood cancer, and we've known this for many years. Other types of cancer, including lung cancer, kidney cancer, bladder cancer, and skin cancers also seem to be slightly increased in people with rheumatoid arthritis. Some of these are related to smoking. The bottom line, the actual disease of rheumatoid itself slightly increases the risk of developing some forms of cancer. The next question, what is the risk of developing cancer while on a TNF inhibitor? This is a really tough question because developing cancer is, believe it or not, quite rare, and it is difficult to assess in scientific studies. There may be a slight increased risk of some types of cancer, like skin cancer. However, whatever that risk is, it's very small. The TNF inhibitors have been around for close to 14 years, so if there was a significant increase, it would have been detected by now. The bottom line is 99% of patients won't develop cancer when followed for a year, regardless of their treatment. When used appropriately, the benefits of the biologic therapy such as anti-TNF would far, and I mean far, outweigh the risks. Most of what we've discussed is very general and might not specifically apply to your situation. You will need to further discuss these issues with your rheumatologist to determine the safest and best treatment for you. I hope you found this video to be useful. For more information, please visit our website www.rheuminfo.com.